Before I begin the main presentation on trauma radiography, I'd like to offer a brief overview of my direct experience in the field. My career began in the U.S. Air Force during the Vietnam era, where I received my initial training in trauma imaging. After returning to civilian life, I worked my way through college by serving as the primary tech during the night shifts in the emergency department, performing routine ER imaging, interventional procedures, surgical radiography, portable studies, and CT. Later, I became clinical director at the Harris County School of Radiology, where I taught both didactic coursework and supervised clinical rotations. Our students trained at Harris County Hospital, located in the Texas Medical Center in Houston, one of the largest complexes in the world and at the time ranked as the fourth busiest Level 1 trauma center in the United States. These experiences shaped my approach to trauma imaging and education, emphasizing precision, speed, and teamwork in a high-pressure environment. Portable radiography in trauma isn't just about capturing images. It is about capturing moments that matter. In the fast-paced environment of the ER, time is of essence, and portable X-rays play a crucial role in quickly diagnosing injuries. These exams allow medical professionals to assess the condition of trauma patients without the need to move them extensively, which can be critical in preventing injury. Patients arrive unstable, unconscious, and surrounded by a flurry of clinicians and alarms and rapid-fire decisions. There's no time for textbook positioning or perfect technique. Portable trauma X-rays can be thought of as working images. A preliminary film of each area of interest is often taken as a quote-unquote scout film. What we're doing here is to get an idea of what the extent of the injury is and how to proceed. It is critical not to move an injured patient until you can ascertain that is safe. These images allow the radiographer to understand how they can move the images or how they can take the images. Radiographers understand how to be able to align the X-ray tube with the patient's part and the receptor to get the best quality information for that particular injury. The preliminary or scout film is critical. For example, tight collimation can restrict the area being visualized, whereas it is good practice for textbook images. It causes more repeats and imaging in the ER to cover all the areas of interest if everything is collimated. In the emergency room, portable X-rays are crucial. Here are the preliminary portable X-rays that are routinely requested. Number 1, chest X-ray. This is one of the most common portable X-ray exams performed in the ER. It is essential for evaluating potential injuries to the lungs, heart, and ribs. In trauma cases, a chest can help identify conditions such as pneumothorax, hemothorax, or rib fractures. Number 2 would be the pelvic X-ray. This exam is particularly important for trauma victims who may have sustained injuries to the pelvis due to falls or vehicle accidents. A pelvic X-ray can reveal fractures or dislocations or other abnormalities that might require immediate attention because the fractures or the area of interest also includes the major blood vessels that we have in that area, and the patient could bleed out if these were severed. Number 3, limb X-rays. These focus on arms and legs, allowing for the assessment of fractures, dislocations, and soft tissue injuries. Portable limb X-rays enable healthcare providers to quickly evaluate the extent of injuries and determine the appropriate course of action. Number 4 is spine X-ray. In cases of suspected spinal injury, a portable spine exam is crucial. Trauma victims may present with back pain or neurological symptoms indicating potential spinal cord involvement. A spine can help identify fractures, misalignments, or other injuries that may require immediate intervention. Often, the portable C-spine is expected to be the first exam the radiographer accomplishes. The problem with this is that the chest X-ray in the pelvis can be more critical in saving the patient's life. Because the cervical spine is already stabilized with the C-collar, eliminating the need to be the first exam taken unless the C-spine is the primary injury. Number 5, the abdominal X-ray. This exam is important for patients, especially in cases of blunt abdominal trauma. An abdominal X-ray can help identify free air, fluid levels, or obstructions in the gastrointestinal tract, providing valuable information about potential internal injuries. Positioning a trauma patient in the ER for a portable X-ray requires careful consideration to ensure accurate imaging while minimizing the risk of further injury. Here are some key strategic things to think about. 1. Minimize movement. Trauma patients should be moved as little as possible to prevent exacerbating their injuries. Portable X-rays allow imaging to be formed at the bedside, reducing the need for patient transport. 2. Stabilize the patient. Ensure that the patient is stable before performing the X-ray. This includes securing any fractures, using cervical collars for suspected spine injuries, and monitoring vital signs. 3. Use appropriate positioning aids, utilizing positioning aids such as sponges, sandbags, and immobilization devices to help maintain the patient's position, ensure quality imaging. 4. Communicate with the patient. If the patient is conscious, explain the procedure and what to expect. This can help reduce anxiety and improve cooperation. Number 5. Coordinate with the medical team. Work closely with the healthcare professionals, including physicians, nurses, and radiologists, to ensure that the patient's condition is continuously monitored and that the imaging is aligned with clinical needs. Next, prioritize critical areas. Focus on the most critical areas first, such as the chest, pelvis, and spine, to quickly identify life-threatening conditions. When positioning trauma patients for portable X-rays in ER, it's crucial to avoid common errors to ensure accurate imaging and patient safety. Here are some common positioning errors to avoid. 1. Improper alignment. Ensure that the body being imaged is properly aligned with the X-ray beam. Tube, part, and receptor alignment is critical. Misalignment can result in distorted images and misdiagnoses. 2. Inadequate immobilization. Failing to properly immobilize the patient can lead to movement during the X-ray, resulting in a repeat because the image is blurry. Use appropriate positioning aids such as sponges, sandbags, and immobilization devices. 3. Incorrect positioning of the X-ray detector. The detector must be positioned correctly to capture the entire area of interest. Incorrect positioning can lead to incomplete images and the need for repeat exams. Often we take a quote-unquote scout film, which would just be simply a positioning of an AP exam under the area of trauma, to see which way to position the patient for the rest of the exams. Number 4, overexpose or underexpose. Ensure that the correct exposures settings are used. Overexposure can result in images that are too dark, while underexposure can produce images that are too light, both of which can obscure important details. Number 5, failure to communicate with the patient. If the patient is conscious, explain the procedure and what to expect. Lack of communication can lead to patient movement and anxiety, affecting the quality of the images. Number 6, neglecting to monitor vital signs. Always monitor the patient's vital signs during the procedure. Neglecting this can lead to complications, especially in critically injured patients. A working image and a textbook image serve different purposes and are created with distinct considerations in mind. A working image is typically used in clinical settings, such as hospitals or emergency rooms, to provide immediate and practical information for diagnosis and treatment. These images are often taken quickly and may not always be of the highest quality, but they are sufficient for medical professionals to make critical decisions. The focus is on capturing the necessary details to be able to assess the patient's condition accurately and promptly. Working images may include portable X-rays, CT scans, or ultrasound images taken during emergency situations. On the other hand, a textbook image is designed for educational purposes and is usually found in medical textbooks, journals, or training materials, such as Merrill's. These images are carefully curated to be of the highest quality and with optimal contrast and detail. The goal is to provide a clear and comprehensive representation of anatomical structures, pathological conditions, or medical procedures. Textbook images are often standardized and may be enhanced or annotated to highlight specific features for educational purposes. Portable chest X-rays play a vital role in assessing life-threatening conditions that may arise in trauma patients. For instance, they can help identify the presence of a hemothorax or a tension pneumothorax, which is life-threatening, both of which require immediate medical attention. By detecting these conditions early, healthcare providers can initiate life-saving procedures such as chest tube insertion without delay. The ability to visualize the thoracic cavity quickly allows for a more accurate assessment of the patient's status, ensuring the critical interventions are not overlooked. The ability to quickly visualize the thoracic cavity allows healthcare providers to make informed decisions about further treatment and interventions. The chest X-ray is a vital tool in the initial assessment of trauma patients. Transporting critically injured patients can pose significant risks, including further injury or deterioration of their condition. Portable chest X-rays mitigate these risks by allowing imaging to be performed at the bedside. This not only protects the patient from the potential hazards associated with the movement, but also minimizes the time spent away from essential monitoring and care. By keeping the patient stable and in a familiar environment, healthcare providers can focus on delivering the best possible care without unnecessary complications. The use of portable chest X-rays fosters enhanced collaboration among the medical team in the emergency room. With immediate access to imaging results, all team members, including physicians, nurses, and radiologists, can discuss the findings in real time. This collaborative approach ensures that everyone is on the same page regarding the patient's condition and treatment plan. By facilitating open communication and teamwork, portable X-rays contribute to a more cohesive and effective response to trauma cases. Ultimately, the integration of portable chest X-rays in the emergency room leads to improved patient outcomes. By enabling rapid diagnosis and treatment, these imaging tools will reduce the time to intervention for critical conditions. Studies have shown that timely imaging can significantly decrease morbidity and mortality rates in trauma patients. In addition to their clinical benefits, portable chest X-rays also offer effectiveness for healthcare facilities by reducing the need for patient transport and minimizing delays in diagnosis. These imaging tools can help lower overall healthcare costs. Faster diagnosis and treatment can lead to shorter hospital stays and reduced resource utilization, ultimately benefiting both patients and the healthcare providers. As hospitals strive To optimize their operations, the economic advantages of portable X-rays cannot be overlooked. For healthcare professionals, familiarity with the portable X-ray technology is crucial. Training programs that focus on proper use and interpretation of these exams can enhance the skill of the emergency room staff by ensuring that the team members are well versed in the capabilities and the limitations of portable X-rays. Hospitals can maximize the benefits of this technology. Continuous education and hands-on training will empower healthcare providers to utilize portable imaging effectively, ultimately improving patient care. Patient comfort is a critical consideration in the emergency room, and portable chest X-rays contribute positively to the patient experience. By minimizing the need for movement and providing imaging at the bedside, patients can feel more secure and less anxious during a stressful time. This focus on comfort not only improves patient satisfaction, but also fosters positive relationship between patients and healthcare providers. When patients feel cared for and understood, it can lead to better cooperation and outcomes. The integration of portable chest X-rays with the electronic healthcare record is another significant advantage. This seamless connection allows for immediate access to imaging results within the patient's medical history, facilitating better patient decision-making, and healthcare providers can quickly review past image studies and correlate them with the current findings, leading to more informed treatment plans. The ability to access comprehensive patient data in real time enhances the overall efficiency of care in the emergency room. While portable imaging in the emergency room offers several benefits, it is essential to acknowledge their limitations. For instance, the image quality may not always match that of traditional X-rays, potentially leading to a misdiagnosis. Additionally, certain conditions may require more advanced imaging techniques, such as CT scans, for a comprehensive evaluation. Collaboration between emergency room staff and radiology departments is crucial for maximizing the benefits of portable chest X-rays. By fostering strong communication and teamwork, both departments can work together to ensure that imaging is performed efficiently and interpreted accurately. Further meetings and case discussions can help bridge any gaps in understanding and improve the overall quality of care. This collaborative approach not only enhances patient outcomes, but also strengthens the relationship between different healthcare teams. Ethical considerations surrounding the use of portable chest X-rays must also be addressed, ensuring that the imaging is performed only when necessary and that patients are limited. Ensuring that imaging is performed only when necessary and the patients are informed about the risks and benefits. It is important to realize that in the portable X-ray, which is a low-dose X-ray compared to, there is very little or almost no chance of overexposing the patient. Another critical portable exam is the pelvic X-ray. This exam is particularly important for trauma victims who may have sustained injuries to the pelvis due to falls or vehicle accidents. A pelvic X-ray can reveal fractures, dislocations, or other abnormalities that may require immediate attention. By assessing the pelvic region, medical professionals can determine the stability of the pelvis and the potential for internal bleeding, which is crucial for guiding treatment decisions. Pelvic trauma is a critical issue in emergency medicine, often overlooked during initial assessments. It can lead to severe complications and even death if not detected properly. The pelvis houses vital organs and major blood vessels, making it a crucial area to examine in trauma cases. Unfortunately, initial X-rays may not always reveal the extent of the injury, leading to misdiagnosis. However, understanding the implications of pelvic trauma is essential for patient outcomes in the emergency room. To appreciate the severity of pelvic trauma, we must first understand the anatomy of the pelvis. The pelvis is a complex structure that supports the weight of the upper body and protects the organs within. It consists of several bones, including the ilium, ischium, and pubis, which form a ring-like structure. This anatomy is not only crucial for mobility, but also for the vascular and neurological systems that run through it. Any injury to this area can disrupt these systems, leading to life-threatening situations. Pelvic trauma can result from various incidents, including motor vehicle accidents, falls, and sports injuries. Each of these scenarios poses a risk of significant force being applied to the pelvis, which can lead to fractures or dislocations. In emergency departments, it is vital to recognize the mechanisms of injury to anticipate potential pelvic injuries. Understanding these common causes helps healthcare professionals be vigilant and proactive in their assessment. One of the major challenges in detecting pelvic trauma is limitations of initial imaging techniques such as X-ray. While X-rays are useful for identifying fractures, they may not provide a complete picture of soft tissue injuries or internal bleeding. This can lead to a false sense of security, where clinicians may underestimate the severity of the injury. Therefore, it is crucial to supplement X-rays with additional imaging modalities, such as CT scans, to ensure a comprehensive evaluation. The consequences of undetected pelvic trauma can be dire. Internal bleeding is one of the most significant risks. It can lead to hypovolemic shock and death if not addressed quickly. Additional pelvic fractures can result in long-term complications, including chronic pain and mobility issues. Recognizing the signs and symptoms of pelvic trauma can significantly improve patient outcomes and reduce mortality rates in emergency settings. Establishing clear goals for assessing pelvic trauma is vital in emergency departments. Additionally, guidelines for when to order advanced imaging should be clearly defined. By standardizing these processes, healthcare teams can ensure that no critical injuries are overlooked during the initial assessments. Collaboration among healthcare professionals is essential for effective management of pelvic trauma. Emergency physicians, radiologists, and trauma surgeons must work together to ensure comprehensive care. This teamwork facilitates timely decision-making and enhances the overall quality of patient care. By fostering a collaborative environment, emergency departments can improve their response to pelvic trauma cases. Pelvic trauma can have a profound impact on the patient's quality of life beyond the immediate medical concerns. Individuals may face long-term physical and psychological challenges. Chronic pain, mobility issues, and emotional distress can significantly affect daily activities and overall well-being. Understanding these implications is essential for providing holistic care to patients recovering from pelvic injuries. Limb X-rays are also frequently performed in X-ray for trauma patients. These exams focus on arms and legs, allowing for assessment of fractures, dislocations, and soft tissue injuries. Portable limb exams enable healthcare professionals to quickly evaluate the extent of injuries and determine the appropriate course of action, whether it be immobilization, surgical intervention, or referral to an orthopedic specialist. The speed and efficiency of limb X-rays are essential in managing trauma cases. In cases of suspected spinal injuries, a portable C-spine or portable spine X-ray is crucial. Trauma victims may present with back pain or neurological symptoms, indicating potential spinal cord involvement. A spine X-ray can help identify fractures, misalignments, and other injuries that may require immediate intervention. By quickly assessing the spine, medical professionals can take necessary precautions to prevent further damage and ensure the safety of the patient during transport or treatment. An abdominal exam, or X-ray, is another important portable X-ray exam in an emergency room, especially for trauma patients. Many times, the physicians will perform an ultrasound or an EFAST exam prior to the abdominal X-ray. This exam can help identify free air, air fluids, or obstructions in the gastrointestinal tract. In cases of blunt abdominal trauma, an abdominal X-ray can provide valuable information about potential internal injuries. The advantages of portable X-rays in ER are numerous. First and foremost, they allow for rapid assessment of trauma patients without the need for extensive movement, which can exacerbate injuries. Additionally, portable X-rays can be performed at the bedside, saving valuable time and resources. This immediacy is crucial in emergency situations where every second counts. Furthermore, portable X-rays can be easily integrated into the workflow of the ER, enhancing overall efficiency. Patient safety is paramount when performing portable exams in the ER. Healthcare providers must take precautions to ensure the patients are stable and the X-ray equipment is used correctly. This includes verifying patient identity, checking for contraindications, and ensuring the protective measures are in place. By prioritizing safety, the medical team can provide effective care while minimizing risk to patients. Accurate documentation and reporting of portable exams are essential in the ER. Radiologic technologists must ensure that all images are properly labeled and that relevant clinical information is communicated to the interpreting radiologist. Timely reporting of findings is critical for guiding treatment decisions and ensuring continuity of care. Effective communication between the radiology team and the ER staff enhances patient outcomes and supports collaborative care. The integration of portable X-ray exams with electronic healthcare records, EHR, has transformed the way trauma care is delivered in the ER. This technology allows for seamless access to imaging results, enabling healthcare providers to make informed decisions. EHR integration also facilitates better tracking of patient history and treatment plans, improving overall care and coordination. By leveraging the technology, the ER can enhance its efficiency and effectiveness in managing trauma cases. Collaboration with other departments is crucial in maximizing the effectiveness of portable X-ray exams in ER. Working closely with trauma surgeons, emergency physicians, and radiologists ensures that the imaging is aligned with clinical needs. This interdisciplinary approach fosters a comprehensive understanding of patient conditions and enhances decision-making processes. By collaborating effectively, we can provide more coordinated and efficient care for trauma victims. Implementing a patient-centered approach in portable X-ray exams is essential for improving the overall experience for trauma victims. Providing clear explanations of procedures and addressing their concerns. By prioritizing patient comfort and understanding healthcare providers can reduce the anxiety and enhance cooperation during an imaging exam. A patient-centered approach not only improves satisfaction, but also contributes to better clinical outcomes. Despite these benefits, there are challenges in implementing portable X-rays in ER. These may include logistical issues, such as equipment availability and staff training, as well as the need for effective communication among team members. Addressing these challenges requires a proactive approach, including regular assessments of workflow and resource allocation. By identifying and overcoming barriers, we can enhance the efficiency and effectiveness of portable X-ray services in trauma care. In conclusion, portable exams are a vital component of trauma care in the emergency room. They provide rapid assessment and diagnosis, allowing for timely interventions that can save lives. Understanding the various types of portable x-rays, their advantages, and limitations is essential for healthcare professionals. By prioritizing patient safety, effective communication, and continuous education, we can enhance the quality of care provided to trauma victims. This is Mark Struthers, and I want to thank you for your time and for your attention. Please subscribe to the Mark Struthers channel. We look forward to doing more projects for you about medical imaging and other areas of interest. Again, thank you for your time and your attention.